Community Plan Sheboygan by Gerke. The role of community nurses has expanded widely over recent years to include independent prescribing, administration of intravenous medications, and more specialist and complex treatments for people with increasing levels of need and dependency. This expansion of community nursing shows not only the great need, but the great demand on those nurses working within the community level of care. In order to address the rapidly changing patient and population demand, new and innovative approaches to healthcare and support systems are needed. These changes require both resources and the support of the community and community leaders to achieve. Therefore, methods that consider such complexities are needed in order to improve the strategic level planning necessary to ensure sustainability of district nursing services. The focus of my clinical experience is to spearhead the creation of a program that is called Safe Space. This program will enlist local businesses and families to aid teens who have found themselves in dangerous situations. There will be an initial period where those who want to participate may sign the contract of involvement and attend the required training classes. An app will be created that help aid teens in using the program and identifying safe spaces. This paper will discuss the community in which the plan will be implemented, the need for the plan, and details for what the plan is and how it will be carried out, as well as how it will be evaluated. The community I have chosen is Sheboygan, Wisconsin, located about 50 miles north of Milwaukee. Of the almost 50,000 residents, 88% of those residents have a high school education, 12% are high school dropouts, and only 20% of the residents have received a bachelor's degree or higher. The population demographics state that within the population of 48,335, 82% are Caucasian, 9% are Hispanic or Latino, 9% are Asian, and of the total population, 9,052 are under the age of 18. That makes up almost 19% of the total population. The population of girls ranging between 12 to 18 will be the focus of my interventions and planning. Within the population, there are multiple opportunities to improve the overall health and situation of the residents of Sheboygan. Some of these opportunities include limited health education, drug use and addiction, improved and increased behavioral health services, and inclusion of residents in the improvement of Sheboygan's educational system. The population of focus for this community plan is at-risk teenage girls. Within this population, there is a great need for intervention and prevention of criminal activity and assault against them. The north side of Sheboygan is bordered by different intersecting streets. The west boundary is defined by roads and the Sheboygan River. The south is bordered by roads and the east is bordered by Lake Michigan. There is a mixture of homes and businesses throughout Sheboygan. The homes range from older homes built in the early 1900s up to newer builds that have been built in the mid-2000s. There are apartments and homes that are well maintained, as well as ones that are in areas that are in need of repair and updating. There are multiple parks, forested areas, and beaches that are open to the public and that are well maintained, visited by families, and patrolled by police and park and recreational staff. During the warmer months, one of the main areas that residents gather is the South Pier. It is on the mouth of the Sheboygan River and has shops, restaurants, and open areas, and is near Blue Harbor Resort, which is a large tourist attraction during the summer months and winter months. For transportation, it is somewhat limited in town, but there are quite a few taxi services that specialize in medical transport. Lyft and Uber drivers are also available, and there is a metro bus system. There are many centers, including United Way, Horizons for Girls, Boys and Girls Club, adult daycares, open door services, along with community outreach from local churches and hospitals. Many of the stores in Sheboygan are locally owned, with a few anchor stores such as a Walmart, Kohl's, Pick and Save, Bed Bath & Beyond, and a few others. The stores are well kept and maintained. Though I have not seen any homeless people or stray animals, I do know that Sheboygan County has 600 homeless people within its boundaries. In general, Sheboygan is well kept with the exception of a few areas of lower income. The majority of the residents are white, non-Hispanic, or Latino, and there is a fairly large Asian and Hispanic population. There are a multitude of churches throughout town. The religious makeup is mainly that of Christianity. Some of the health indicators for Sheboygan are high blood pressure, high cholesterol, mental health conditions, asthma, diabetes, heart disease, smokers, and alcohol use. All of these are higher than the average in Wisconsin, and at-risk teens and women's health are focus areas. Many of the people I have encountered through my canvassing support President Trump, but when pressed to have not the ability to give evidence as to why they support him. In terms of media, the main media source in Sheboygan is radio and a few public TV stations. There is a large number of businesses and industrial facilities. Some of the factories include Old World Sausage and Nemac. There is a multitude of businesses, many of them are small businesses owned by residents of Sheboygan or the surrounding towns. The town covers 54,157 square miles with a population density of 105 people per square mile. Sheboygan is directly adjacent to Kohler, Wisconsin, where Kohler Company, one of the largest manufacturers of bathroom and kitchen fixtures, is located. Kohler Company, the boundaries of Sheboygan include Lake Michigan to the east, the Sheboygan River to the west, and north and south boundaries are defined by city and county roads. Some of the main tourist attractions in Sheboygan are Blue Harbor Resort, where a water park and spa are located, and the American Club, a prominent golf course resort and spa. The pier and the surrounding businesses are considered a tourist attraction. According to statistics, the chance of becoming a victim of either violent or property crime in Sheboygan is 1 in 41. Based on FBI crime data, Sheboygan is not one of the safest communities in America. Relative to Wisconsin, Sheboygan has a crime rate that is higher than 84% of the state's cities and towns of all sizes. Sheboygan is only safer than 25% of the towns in the United States. The annual crime rate is 1,202 total crimes. 139 of those crimes were violent crimes. There is a variety of schools available for residents, including public, private, charter, and parochial schools. This variety allows parents to place their children in an environment that best suits their learning style. Though these options are available, the majority of parents choose to move their children out of the public school system or are unaware of the options. The highest level of education is a high school diploma for 88% of the residents. The level of education obtained by Sheboygan's residents directly impacts their ability to understand their current health status and their health care needs, both presently and in the future. There are over 20,000 homes and apartments in Sheboygan. The price range of most homes are between $57,000 and $229,000, with the median home value being $139,000. 32.3% of the homes were built in 1939 or earlier, and 35.6% of the homes were built between 1940 and 1999. Overall, Sheboygan County is ranked number 26 out of 72 counties on the ranking of health status. The results show 14% of Sheboygan County is in poor or fair health. 15% of adults smoke. 29% of the county residents are obese, and 6% of people in Sheboygan are uninsured. These statistics show that many Sheboygan residents have lifestyles that will and do contribute negatively to their overall health. Smoking has been linked to diseases of the lung, stroke, heart attack, and other cardiovascular diseases. Obesity has been linked to cardiovascular disease, diabetes, and in some cases, a strain and wearing on the body and the different body systems. The Sheboygan community has a population growth of approximately 150 a year. Of those births in Sheboygan, 92.6% of infants are born at the healthy rate, weight, and time frame. The average range of age of death is 75 to 84 years old. Of the deaths recorded, 188 were related to substance abuse, including illegal drugs and alcohol. Due to the residents' limited understanding of the medical care of all the hospitalizations, over 1,000 of those hospitalizations were preventable. In this community, the factor that accounts for the majority of hospitalization is mental health disorder. With there being only 2 behavioral health facilities in Sheboygan, it limits the resources that residents have to be able to seek help. Those behavioral health facilities are a part of Aurora Sheboygan Memorial Medical Center and the Aurora Behavioral Health Clinic. Aside from behavioral health, the next most prevalent medical conditions are diabetes, heart disease, and chronic obstructive pulmonary disease. Heart disease accounts for the largest number of associated deaths at 252. Of all these disease processes can lead to complications that affect the entire body and can cause overall deterioration of the community's health. Also, due to the lack of understanding, many residents are not compliant with their medications and treatment plans, causing extensive complications, worsening of symptoms, and hospital admissions and readmissions. Of all medications-related hospital admissions, approximately 33 to 69 are a result of medication non-adherence. These readmissions add strain to an already tight community health care system. There are a multitude of healthcare clinics in town, ranging from family practitioner to systems specialist. Sheboygan County Community Health Improvement Program is aimed at identifying the weaknesses in the current system and to fill in the gaps and provide coverage in areas that are currently being missed. The community also has social service centers, including United Way, Horizons for Girls, Boys and Girls Club, adult daycare, open door services, along with community outreach from local churches and hospitals. These services work to benefit the youth of the community, as well as adults in need of extra care that do not need to be in a hospital or in a long-term care facility. United Way partners with the community to raise awareness on subjects such as bullying, teen pregnancy, teen suicide, and sexual assault. Horizons for Girls focuses on what they call at-promise teens. These are teens who are who have difficult home lives, are struggling in school, are pregnant, or are teen moms, and help them to develop coping strategies and help to develop a success plan that will lead them to their life goals. There are 3 outpatient surgical centers available for ambulatory surgical procedures and 4 urgent cares for residents with acute changes in condition outside of normal medical office hours. There are 2 emergency rooms attached to the community hospitals. These emergency departments are overburdened due to the lack of understanding in the community on the correct time for a emergency department visit versus urgent care or waiting for your primary physician. The inappropriate use of the emergency system means longer wait times and a delayed care for those who are in need, and the immediate care offered by emergency departments. In reverse, due to the lack of understanding, symptoms go unnoticed or ignored until they become dangerous and life-threatening, causing an increase in hospital admissions and oftentimes readmissions related to medication non-adherence and complications to chronic disease processes, such as COPD exacerbation and CHF exacerbation. These numbers are represented on the chart. Community partners are essential to the successful plan and implementation related to a specifically identified goal. This approach is based on the philosophy that improvements in healthcare are most successful when community members are involved in the full spectrum of action, from problem definition to intervention. By involving members of the community in all stages, you help to ensure the success of plans and interventions by creating a respectful and mutually beneficial relationship. One of the community partners that I have utilized is Corey Butters. He's the principal of George D. Werner's school. This school is one of the Sheboygan area schools, and it has approximately 10,000 students amongst the 26 schools included in the Sheboygan Area School District. The partnership with Principal Butters allows me access to students in both the junior high and high school level. The partnership also allows me an inside look at the school's structure, policy, and programs, as well as allowing me to see where there is need within the school. My partnership with Shar is one that gave me direct access to some of the at-risk teens that I am working to create my plan for. She is the founder and CEO of Horizons for Girls, a not-for-profit foundation that mentors and benefits at-risk teen girls ranging from 6th grade to senior year in high school. The partnership with Shar has given me the opportunity to interact with the target group of my project. I have been given the opportunity to observe and converse with these girls, allowing me to better understand their needs and what they hope to get out of the program. Shar has also helped me to connect with other partners in the community, including Principal Butters and other school administrators in Sheboygan. The use of resources and assets while working to improve problems within the community is a vital part of ensuring the longevity and successfulness of the program. By assessing resources, one can determine if any further needs are present before beginning the process of planning and implementation. Mental Health America of Sheboygan County offers a comprehensive guide that lists and describes the resources available in the Sheboygan area. Hospital community health investments are a vital source of funding for various public health activities. Better coordination can help foster a more efficient use of resources available to improve community health, which is essential for achieving population health improvements in the resource-constrained operational environments of both local health departments and nonprofit hospitals. One of the resources in Sheboygan that works closely with the group I am affiliated with is Safe Harbor of Sheboygan. Safe Harbor provides confidential emergency shelter and supportive services to anyone suffering from the effects of domestic abuse and/or sexual assault. This resource is vital to many of the girls I have encountered, as many of them have experienced some form of abuse from a family member, significant other, or even a stranger. The second resource is Horizons for Girls. This program is a mentoring program for girls in the area, including career exploration, life skills, study skills, tutoring, and communication skills for adolescent girls who have been identified as at risk for behaviors exhibited or living and family situations that have been identified as risk. I am directly involved with this group and have used my exposure in this group to identify specific needs of this demographic. The target population is at-risk teenage girls aged 12 to 18. The nursing diagnosis that I have determined for this community is poor life outcomes among at-risk teenage girls related to adverse life events, including but not limited to sexual assault, domestic abuse, at-risk behaviors, and drug use and abuse. So the purpose of my plan is to reduce the occurrence of at-risk behaviors and assaults against teenage girls. My context is Sheboygan is a small town that has a multitude of underprivileged families and that an overstrained healthcare system. Inputs are community groups that support at-risk teens, local government officials who work to improve living, school administrators, healthcare system, and government assistance programs. Activities are to create a detailed program and contract, get program approved by the local government, canvass businesses and residents to determine interest in a list, create an app that allows teens to identify safe spaces near them. For the reasons of anonymity, the safety of the teen, the app cannot reverse identify teens to protect them from potential threats and harms. Set up education dates and enroll participants in classes. Set up educational sessions at local schools to inform students of the purpose and presence of the program. Give approved businesses and residents a sign that identifies them as a safe space. And roll the program into action. The output, a detailed program is created. Approval of the program. Businesses join the program, families join the program. App that allows teens to find homes and businesses in the program. Education classes are created to train participants. Educational classes are made available to students, and window signs are distributed, and program is active in Sheboygan. The hopeful effect of this program is education of local businesses and families on the need of the program, as well as education on risk behavior and the use of the program to teens. A reduction in at-risk behavior and a reduction of assault on teens and as well as sexual crimes against teens. The partnership wants to create a safer environment for teenage girls. To help reduce the number of teens exhibiting at-risk behaviors due to pressure and give a refuge to those who feel unsafe. The requirements are businesses with extended hours or open 24 hours a day, such as gas stations, hotels, restaurants, fire stations, police stations, and hospitals. Homes of families that have undergone background checks. Both businesses would need to sign an agreement to have employees trained on how to handle different situations and help reduce the risk to persons involved. Families would need to undergo training and signs stating that they can limit assistance of a person entering their home if doing so puts their family in immediate danger. In this instance, the police would need to be called. Restraints are the cost of training and printing of information, the possible interest of residents and businesses to get involved, and the willingness of teens to seek out aid if they are in a dangerous situation. And the danger of giving aid as well may pose a risk to those who are helping. The partnership will measure the progress of the objective by the time steps. The program will be finalized and approved and endorsed by a local governing body by July 1st. By October 1st, 25 businesses and families will have read and signed the contract to join the program. And by January 1st, 2019, all business owners and current employees will be trained on the program and proper handling of situation, as well as families have undergone training and background checks. The objective will be evaluated by whether the program has been approved, enrolled parties have been trained, and the program has gone live by the intended dates. The objective can be accomplished by partnering with local advocate groups and government officials to create an agreed-upon program and work to educate the community on its purpose, and work to enlist members of the community to enroll and get involved in helping the younger members. It is also important for schools to get involved and educate teens on this resource and what businesses and homes are enrolled. The logical steps to this partnership are communicate the need, communicate the initial plan, create a detailed program and contract, get program approved by the local government, canvass businesses and residences to determine interest and enlist, create an app that allows teens to identify safe spaces near them, set up education dates and enroll participants in classes, set up educational sessions at local schools, give approved businesses and residences the signs identified, and roll the program into action. This is a worthwhile objective as it will help reduce and prevent crimes and dangers teens are in the Sheboygan area. This is the right time. Currently, there is a rising need for social services and victim services related to the abuse and sexual assault in Sheboygan. In 2010, there were 12 convictions of sexual assault on a child. According to the 2018 study on sexual harassment conducted by the Stop Sexual Harassment Foundation, 2,000 men and women were interviewed, and 74 women ages 18 to 24 experienced verbal harassment. 50 experienced physically aggressive sexual harassment, and 24 experienced sexual assault. Though these are not specific to our age group I am focusing on, it shows a relationship to those girls entering the few remaining years prior to adulthood and the dangers they face within our community. Sheboygan does have the resources to accomplish the objective. There is a multitude of community resources that could be included in the process and progress and implementation of the objectives. Though there is a great need for this objective to be implemented now, it is of the utmost importance that the time is taken to ensure its success. By working with government officials and other community resources, it will increase the effectiveness and successfulness of the objective. The partnership plans to have the objective completed by January 2019. The evaluation of the success of this plan will be by a reduction in the number of crimes involving teen girls by 15% within the first 6 months and by 25% in a year. The reduction of sexual assault on teen girls by 25% in the first 6 months and by 35% in the first year. I would measure the progress of the project to ensure that the program was on track for live release and the beginning of the true impact. I would also measure the use of the program. How many instances of use are there within the first year of the launch of the program? If the program is not successful, I would create a focus group and determine the impacts on the demographic and the target and who is being targeted by the program. This focus group would include teens and businesses and figure out where the disconnect is. Do the teens not understand how to properly utilize the program, or do the adult participants not understand how to appropriately interact with teens and how to properly handle the process of situations? Additionally, education pieces will be created to readdress gaps in understanding, and educational sessions will be created to help our participants be successful. Public health workers and planners often overlap in their goals, promoting safety, enhancing accessibility, and evaluating the impact of the built environment on community health and well-being. Despite the common ground, public health and planning do not regularly work together. By working with stakeholders in the community and other resources with similar goals and objectives, you can increase the possibility of success and longevity of the program and community plan. Teens are by nature a vulnerable population, but by adding risk-taking behaviors, they increase their vulnerability and create a special population that needs additional interventions.